Hello viewer, my name is Lucy Wanza-Kariuki. I am your host for today's show. This is a health talk show whereby we are deliberating on matters about health. Today we are talking about infertility, which affects both men and women. It is something that has not been understood, especially when it comes to the part of a man. But in the house today, we are having healthcare workers who are going to help us go through the show as we deliberating on matters concerning infertility. To our guests in the house, welcome to the show. And I would like you to kindly introduce yourself. Welcome to the show.
Okay. Hello viewers. My name is Riziki Zainabu. I'm a clinical officer working at Mwala Level 4 Hospital in Machakos County. I'm a clinical officer. And by specialist, I'm a reproductive health specialist. I'm glad to be invited in this show to talk about infertility. Thank you.
Welcome to the show, Riziki.
I'm Mary Guge. I'm a counselor. I'm also a trainer in counseling. I work with InHope, that is Integrated Holistic Therapy, Dr. Sparasa Ruiro. I also work with Nairobi Pentecostal Bible College as a trainer in counseling.
Yes.
Yeah.
Which type of counseling do you do mostly?
Mostly I do family and marriage counseling.
Family and marriage counseling.
Yeah.
Thank you and welcome to the show, because the matter at hand today really concerns families. And as we continue to discuss, we would like our clinical officer, Riziki Zainabu, to bring us on board. Is it really that infertility is there?
Okay, thank you, Lucy. Yes, infertility is real. It's there. It's not a condition or a disease per se, but it can cause other psychological issues thereafter.
Okay.
But what is infertility? Infertility is inability or failure to get pregnant. Either female is not able to get pregnant or the man is not able to get the female pregnant within a duration of 12 months.
12 months?
Yes, 1 year.
So in 12 months, in a period of 12 months, which is 1 year,
yes,
you've been together,
yes,
you are having sexual intercourse,
yes,
but unprotected,
yes,
and no conception,
yes,
no child. That is what we call infertility.
yes.
Thank you so much for that definition. Kindly let us know, infertility. What are the signs and symptoms? You've said something very clear, that this is not a disease.
No.
What is it?
Okay, it's not a disease.
Yes.
But it can be caused by other diseases. It's just an inability to conceive because of several factors. Maybe caused by a disease or naturally you're not able to conceive. Yes.
And at what point do these people realize that this is not just any other thing, but now we can say we are unable to conceive? At what point?
At what point? Okay, thank you, Lucy. I've said it's a duration of 1 year. But how will you know that you're not able to conceive or your partner is not able to?
Or how do we diagnose?
Yes, how do you diagnose?
Yes.
Yes, you've said it's the history of 1 year. But the couple has to be sexually involved. Frequent sexual intercourse within a week, let's say 3 times a week. You have to have unprotected sex with your partner. Unprotected.
Yes.
Yes, we are not using any family planning method. But you've tried and you're not able to conceive. That is what we call infertility. The
other diagnostic measures?
Yes, the history. Yes, history. Then thereafter, we do other investigation to assess or to know why the couple is not able to conceive. It can be the female. WHO says 30% can be the female, 30% the male. 30% can be both. You can both be able to be unable to bring forth a child. So it's not only female, it's not only male. It can be male, female, or both. And 10% it can be unspecified cause. We don't know who has a problem. We've done investigation on both. We really can't pick out the cause.
Okay. Are there types of infertility?
Yes, we can have primary infertility and also secondary infertility. Yes.
Kindly let us know which is which.
Okay. Primary infertility is for a person or a couple that has never had children before. They have tried for years, they have never been able to conceive. That is primary infertility.
Suppose we have a couple.
Yes.
They've been married for 3 years.
Yes, 3 years.
No child.
Yes.
But the woman or the man has child outside this relationship.
That is not
Is
primary
this infertility?
It's infertility, yes, but that is not primary infertility.
What I'm
Infertility
asking
you've
is,
never
Riziki,
conceived. Yes.
You have a child outside this current relationship.
You're not infertile. You're fertile.
Okay.
Yes. Primary infertility, both have never had the ability to sire a baby, has never had ability at all in their life. That is primary infertility. But if one partner has ever had children and the other partner can have primary infertility, but the other partner who has a child, we won't term him having primary infertility. He has a seed. So and if he's not able to conceive now in this other marriage, then we can say that is a secondary infertility. You had a child earlier, but you're not able to conceive now or make a woman pregnant now, but you had children earlier. That is secondary
Before we come to Mary, can we also add a third one? Partial infertility. The couple, one has had a child outside this relationship.
Yes.
But now both cannot be able to have child together. Is it partial? Or is it part of primary, secondary? You will tell us that. I don't know. If it is not in your books, you will tell us if we can invent a third one.
Okay.
You know, we are also scientists.
Okay.
Mary.
Yes.
Where do you come in? Because here is a couple that has worked together for over 1 year.
Yeah.
Because I'm sure others will never realize that they are infertile until they hear it from mother-in-law, sister-in-law, or we friends start asking what is not happening. That is when they come into senses, oh, by the way, I've been in this marriage and no children. And now depression comes, stress comes. At what point do they come to you?
Clients at times, or the patients at times will not, like you have said, they will not realize that they have a problem. Other times they will have some fear to go to counselors because of the stigmatization that is there about counseling. Counseling has not been understood clearly in our country, and maybe I need to talk about counseling a bit.
Yes.
What is maybe mainly difference between my clinician here and me as a counselor? When the client comes to me, mainly we'll handle this, what we call the model we use, psychosocial and spiritual model. I want to elaborate that more. When we talk about psychosocial, we are referring to the psychology of that particular person, the mind of the person. We are also referring to the social, that is interactions, how the past people live. There are usually difficulties when we deal with infertile couples because of what they are experiencing.
Yes.
We have spiritual because of value systems that, like, I believe, like, if you are a believer, for example, you'll be given a child by God. The other things like the issue, like, I will not go for counseling because to us sometimes it is psychiatric. People think if you are told to go for counseling, it's like you are not normal.
Is for mental health
disorders.
Goodness.
So I would want to explain here that counseling is for normal people who are experiencing difficulties in their life. And that is why we are there as counselors. It is not for abnormal people because we have two professionals. We have psychiatry for disorders, and then we have the counselors for normal people who are experiencing difficulties, like now, that difficult of not having children. Now, what is my role as a counselor? First, I will assess. I can do assessment. of the psychosocial problem the person is having. Say, for example,
when you talk of psycho, I understand psycho means the mind.
The mind.
Social means the network we have with people. So you're dealing with this person as an individual, and with this person as an entity in the society.
Yeah.
Okay.
So in training as a counselor, you are trained how to assess for example, the disorders, the mind of the person, because we believe the behavior of the person will be determined by the way they think and the way they feel. So you assess their psychology, you assess the way they are thinking, you assess that is about the psychology, the mind of that particular person.
Yes.
And then you assess, are there any relationship problems? That is the social problems. Then you look at the spiritual. Are there spiritual problems that you as a counselor need to work with this client? You also look at the emotional problems. I will give examples of each. Like, for example, we say psychological, depression, anxiety, all those. And then we have social problems. We have like conflict. Maybe because they are infertile. They have not gone to seek intervention. They have not gone to talk to a clinician. There is blame game. So there is a lot of conflict. There is also conflict from extended family, where maybe they feel like, why is our daughter-in-law or our son-in-law not having children? Why is our son not having children? So there is a lot of, so you help them handle the conflict. You also help them by doing some assessment, understand that they can seek more intervention from clinicians. So we work in collaboration with the clinicians. An example of an emotional problem is like anger. Somebody is angry with the wife, angry with the self, angry with the husband, angry with God. Yeah, you are feeling so angered by why God is not giving you children. For example, people who have faith-based, you have served God for many years. Yeah, so you are wondering, this God I have served him, why hasn't he answered my prayer? Maybe you have been praying for that year, and so you are so angry with God. So such emotional issues. Others are feeling guilty. Maybe at a point in life, somebody was involved in sex and got an STD, and which maybe was treated, and then thinks, could this be causing what I'm going through? Others have done abortion earlier in their life. And so they connect whatever they are going through with what they did earlier when they were not married. So they are feeling guilt, they are feeling ashamed, all those emotional problems we do handle them.
Before you continue, you can hold it there as we go to Riziki to give us some of the causes, because Mary has mentioned a few, but in brief, kindly let us know what are some of the causes or contributing factors to infertility.
Okay.
Yes.
Infertility, like we've said, it's either a man or a female or both. There are things that cause infertility. We've said we have primary infertility.
Yes.
Mostly are genetic things that happened maybe when you're in your mother's womb, things that cannot be reversed. Some are reversible through surgery. Primary infertility. Secondary infertility is infertility happens thereafter, after you've conceived your one or many babies back then. But there are other causes have come in that has hindered you from conceiving. Things like STDs or STI, she has mentioned. If you get them and they go untreated.
Thinking of genes or
genetically, yes.
These are things like
genetic
which
anomalies.
run in our families.
Yes.
In that particular family, the women have abnormal uterus. In that family,
genetic anomalies,
yes, you will find abnormal hormones.
True.
In short, these are things that even to rule out, is it easy?
Yeah, it's not easy.
It's not easy.
It's not easy.
Because sometimes it may be even late to come to realize this.
Yes, it's
okay,
not
continue.
Easy. That's why I was saying primary infertility, it's difficult. There might be things you are born with.
Okay.
They are difficult to reverse.
Primary.
Yes. But secondary infertility are things that happen as you go on, like infections.
Yes.
They can cause tubal blockage in female. They can cause abscesses. Yes, such infection that went untreated. Yes, like she has talked of abortion or any surgical procedure that will bring scarring in the reproductive system of a female. Yes, it will cause infertility. Any drugs that this mother is using, especially the cancer treatment drugs, the radio and chemo, they can affect the ovaries. Yes, they can
because
affect.
we understand that cancer drugs usually attack the DNA of a person.
Yes.
And when we are talking about DNA, that is where the human person originates.
Yes.
So from the DNA to the cells, you're already deformed.
Yes.
Okay.
So medication you're using, any infection, any surgical procedure that was done on you and left scars, any tumors or masses in your in the female reproductive system, or anything around
the uterus.
Yes, around the uterus. If you have a growth around there, it will obstruct.
Wow.
Not necessarily from inside, even from outside your uterus, it can obstruct.
Very important point.
Yes.
There are drugs.
Yes.
Masses in the uterus, like cysts.
Or anything in the abdomen.
Yes.
Any
Good.
mass.
What about our men?
They are almost similar because it's either obstruction or not formation of sperms. Not formation of sperm. What is this? This man maybe had prior infections that obstructed the testicular tubes. It's not able to deliver the sperms once ejaculated. So yes, infection, also medication, also cancer treatment, they can affect the man, the production of the sperm or travel from the sperm to the testicles to the woman. Yes,
Okay.
they are almost similar.
Yeah, because I also understand injury of the male organs.
Yes, anything that will cause scars.
Like I saw another boy who was pulled the testes by a friend in school, and now comes with what we call testicular torsion.
Yes.
And I would imagine surgical procedure at the age of of 9. Now that one can also contribute in future.
Yes,
because that is now
injury.
Yes, it will form a scar.
Yes.
Okay, the other one was you can talk more about that, temperatures. Change of temperature. There is no travel for long.
Yes.
Long distances, you seated, you sit,
or even those
in the office from morning to evening, and from there you rush to hot water. I understand that hot water causes sudden changes of temperature in that area. There are those who must bathe with very hot water. So men, kindly, let it be a bit warm.
Yes, that's the reason why their reproductive or their testicular, the origin of the sperm, it's placed outside the body. It's not like a female.
Yes.
Everything is within the body. For men, it's placed outside the body for regulation of temperatures.
Other things like cigarettes and
those are predisposing factors. Yes. You'll have they will cause production. They will interfere with the production. You'll have unhealthy sperms, even in female. Yes. They will cause unhealthy ova. Yes.
Wow.
So lifestyle is also a contributing factor.
In 1 minute before we go for break, what do you want your viewer to hear from you?
I want to encourage my viewers to seek psychosocial support.
Yes.
Because at a point when you have a difficult, and especially that is bringing a lot of stigma from the environment, you have disturbed mind.
Yes.
You undergo issues in your mind that will tell you are not okay, you are not like other people, your self-esteem will go down, you can enter into depression, you can be stressed until your normal functioning is affected.
Okay.
But if you have somebody to work with you, somebody who can tell
you're telling us that psychosocial support is very important to deal with the issue of infertility, to deal with the family, to deal with any external pressure that you're facing because of the inability to have children. Keep it tuned, our viewer. This is GBS TV Africa, and we are here with you to talk about health. Keep it tuned. We shall continue after the break.
Mziki right here on your #1 TV station, GBS TV. My good name is Hypolar the Experience. You can call me Moja Sa. Ukumazel the best TV ever. Lafu shoni gani Mziki SMS line 21144.
Tunakuchezea zile ngoma mpya zenye zimekuwa zikitokea hii wiki.
Anytime ulizia Vila God nikulia na wakinikeuzia. I know you got me, girl. Yeah, you got me, God.
Kautamu nikisa maneno nasikia kautamu. Ati wanauliza gospel imedu bisa CMT we have to do. So Bible now we hand, so we physically, spiritually, lyrically, mentally.
Leo manze tuko na wasanii wa daily ndani ya nyumba. Tuko na muziki kali, tuko na countdown kali. Yaani kila kitu leo iko fresh. Chukua sharubati, hiyo ni juice hapo. Mpaka mguu juu ya meza.
Triple.
Yeah.
Tumia mtu salamu pale mali unakulanga chapo dondo.
Nani mimi? Walifunga.
Hello guys, this is the 77%, the platform for Africa's youth to debate issues and share ideas.
You know, on this channel, we are not afraid to touch on delicate topics.
Africa's population is growing fast. Why is African identity so important?
Why are we so religious?
What is the relationship between religion and corruption in African countries? Let's hear what you have to say.
Let the discussion begin.
Young people have felt for the longest time that they were not part of the conversation.
And we want to find out why.
Poverty is poverty. It's not about where you come from. It's about trying to survive. And everybody's trying to survive. It doesn't matter what country you come from.
How come the dress code rules are for the women and not for the men?
It is not fair.
You belong to society.
Oh.
Yes.
Oh, no.
So yeah, looks like we're all ready for a fight, hasn't it?
They don't know the hard living that we are going through. Okay. They don't know.
So I guess in a lot of ways we still have a long way to go.
And young people clearly have the solutions.
The future belongs to you.
Everywhere, GBS. Welcome back, our viewer. We are here in GBS TV Africa and we are continuing with our talk about infertility. We have another guest who has just joined us, and before we proceed, I would like to give him an opportunity to introduce himself. Welcome to the show.
Thank you, Madam Lucy. My name is Pastor Patrick Eseli. I come from Machakos County, Kangundo Sub-County. That is where I serve as a pastor. Thank you.
Thank you, Pastor. Welcome to the show. We are speaking about infertility. But before we continue, kindly, Riziki, you are an expert in reproductive health. Yes. You've walked the journey with the patients. You have seen them through as they prepare to conceive, but conception has not happened. Kindly let us know, what are these? What are we waiting for? What is wrong?
Okay.
Yes.
Okay, thank you, Lucy. There are so many expectations for this person who is not able to conceive for the last 1 year, or even some come after 5 years or 10 years. Though they are anxious, they have a lot of expectation. They don't know why they are not able to conceive. So when they are coming to you, one, they are anxious of diagnosis. They are anxious, they want to know the cause. Why am I not able to conceive? They are anxious, they want to know what modalities or methods are there for treatment. And will it be successful?
Yes.
So when they come, they are anxious. So for the three,
is anxiety another factor, if I can ask?
It's also another factor or a predisposing factor, because once you're anxious, you interfere with your physiology. You might be able to conceive, or maybe you're having less frequent intercourse. You're not really infertile, but you come with that anxiety that I'm sick, that I'm not well. So they come with anxiety, and anxiety is one of the cause of.
In short, you're telling us it can produce stress hormones.
Yes, it
which
can.
are going to affect
yes, the physiology,
the fertility, the working of the body.
Yes.
Yes. So, Pastor,
yes,
I'm sure you've been following this discussion, and these people are in our community. They are in your church. You are a marriage counselor. I'm sure these things come to you more oftenly than we expect, because some people are just too tired of waiting. They've been in our clinics. They've been on follow-up. Things are not working. And now they are there seeking for refuge. How do you come in this?
Thank you, Madam. It's a challenge.
Yes.
And the cases are not few. There are many in the society outside there. And we normally know them because as pastors, this is the first place. Even before people go to seek for medical attention, they come for prayers. And so it's a reality. It's a reality. And you know, normally when people enter into marriage, they come with high expectation.
Yes.
In between them and also from the society and even the church. They expect after some time.
Even the man of God.
Yeah,
praise God.
Yeah.
Wow, when are we expecting the good news?
Yeah, we expect them to have children.
Yes.
But one thing I would like to say is the Bible is not silent about it. There are so many cases of infertility in the Bible, beginning with Sarah, the father of faith. When you look at Genesis chapter 11, you find that Sarah was had the same problem of infertility and things like that.
In fact, more than our menopause.
Yes, yes, and even his son Isaac, his wife Sarah Rebecca, the same. Jacob, their grandson.
Pastor, hold it there. Are you trying to tell us that this case of infertility may be more than we think? It can be very genetical. Now, Riziki, our daktari, explain about genetics. You're now proving that it is true.
Yes, it can. We can say, because when you look at the way I'm just saying the pattern, you find it is there. It is there. Jacob's wife Rachel had the problem. So these things are there. And they're very traumatizing.
Yes.
Yes.
Thank you so much for that. Riziki, these things are there.
Yes, they are there.
Yes, said it.
Yes.
How can you prevent?
Okay. Ways to prevent infertility, especially secondary infertility. We have predisposing factors, so we should watch out on them, especially smoking, alcohol intake, exposure to industrial waste or chemicals, and exposure to radiation, especially those who work in X-ray department, any radiation department. So, and also any unnecessary drug abuse. Yes, we should prevent. We should be cautious of what we eat, what we put into our body, and also exercise. Sedentary lifestyle has been also associated with infertility. So exercise is key.
On that note,
yes,
how does being overweight, being obese, being tiny, being having malnutrition, have to do with with infertility? Yeah, it has a key role. Like we've said, sedentary lifestyle will cause you to be overweight. When you are overweight, it's associated with infertility. There are hormonal imbalances when you're overweight and when you're underweight or malnourished. It will affect your hormonal balance in your body. Does it mean that it can also cause blockage of the fallopian tube? Not necessarily. It's just affect the production. Yes, the production and circulation of your hormonal system. It's getting interfered with. Yes, maybe overweight, maybe because there is a myth. Yes, in our village. Yes, which says that when you are overweight, the sperms cannot run. They can. They cannot. Because the journey there is very tough. There are hills and mountains. It's a myth in our village, not in our medical books. But you remember, we all have origins?
Sure. Okay, our reproductive system is well protected wherever it is. It's well caged. So, and again, for a sperm to swim up to the ovary and fallopian tube, it is assisted with the motion and the fluid and everything. So mostly overweight affect the hormonal balancing in your body, but not necessarily obstruction.
Man of God, apart from prayers, because I know if it's prayers, you've really prayed. In fact, you've done the anointing using your hands, and even the anointing oil, and even the fellowship and deliverance and casting of the demons. Apart from all that, what is that other truth that you need to tell the client before he or she goes home?
Thank you. That's a good question. One, we should divine issues here. A family is not made up of it's not a must that there be children so that we may call a couple a family. The two of them
It's too heavy.
The two of them are a family. They bear God's purpose, and they are complete, and they can pursue life and live a fulfilling life like any other person.
Yes.
Because the Bible says children are a blessing from God, and you cannot force a blesser. You can't manipulate a blesser.
Yes.
If God chooses to bless you, He blesses you. Because the Bible says children are an inheritance from God. So if they are an inheritance from God, then does it mean that this is not a family? It's a family. Because the Bible says, for this reason a man shall leave his father and mother, and the two shall become one flesh. So that was a family. Children are additional. So what I can say to those families that are having these problems, the issue is, I know it is stressing. It is very stressing to have no children. Like I remember Rachel telling Jacob, give me children or I die.
Oh my goodness.
That tells us how stressing it is. That means there is blame shifting.
Yes.
You are the cause of my trouble. So what I can say is, as much as stressing it is, let these couples know that they are a family and they can live a healthy life, the two of them.
Before we come back to you to tell us, suppose now a couple comes to you carrying the marriage certificate because you're the one who officiated the marriage, and tell you that your marriage has not worked. In fact, now it is not theirs, yours has not worked. And now we have come with a marriage certificate to bring it back to you. Before you tell us how you will react, let's go back to Riziki.
Yes.
Riziki, tell us. Yes. Men, most of the time, do not like being associated with infertility.
True.
They don't.
Yes.
They believe that infertility is the fault of the woman.
Yes.
She's the one who is supposed to conceive, not me.
Okay.
How do you handle such in the hospital?
Okay, that is common also. Mostly you see a female coming to complain that she's not able to conceive, but leaving behind the husband.
Yes.
In treatment and diagnosis and trying to find the cause, we need couples to come in board. You can't
not
come
the
alone.
woman.
No, we treat both. If we have to do an investigation, we'll do to both. We have male investigation and female investigation so that we identify where the cause or the problem is. So we have to bring
I have
you
a question
board.
there.
Yes.
Suppose now from your analyzing of sperms,
Yes.
hormones, urine,
Yes.
whichever,
Yes.
the man
Yes.
as no sperms. You know there are those states.
Yes.
It's called oligospermia.
Yes.
Is it oligospermia?
Yes.
Kabisa.
Yes.
No sperms. And now this is a couple.
Yes.
How are you going to break the news?
Okay.
You are the doctor who has been following them. Kindly
Yes.
go come with your husband. The husband comes.
Yes.
Yeah, the results are in your hands.
Okay, thank you, Lucy. We've said we have to involve both from the beginning to make work easier. And before you do all the investigation, you've done prior counseling You've talked to them about possibilities. It can either be the female, we can find this. It can either be you, the man, and we explain what we want to intend to do with your sperm analysis. We'll explain before we do it. So it becomes easier to give out the results when you explain prior.
How does surrogacy come
Yes.
there?
Okay.
In that case,
That
how
is-
is it in our country?
Yes.
Is it advisable? Is it a
Okay.
law?
Okay.
That and also, can you explain to our viewer what is surrogacy?
Okay. It's one of the modality of trying to help couples have babies. There are several. So surrogacy is one of them. Surrogacy is having these couples seed, I would say, an ova and a sperm from the couple. You fertilize it from outside. Once it's the embryo that forms, you can now put to a surrogate mother, a person
Somebody
who has
else.
volunteered, yes, who has volunteered to carry your baby. So we'll take the sperm and the ova from the couple. If they're not, if the mother is not able to carry in her womb, we get a surrogate mother to carry the baby for her.
We've seen these things in the movies.
Yes.
In fact, there is a Kenyan movie airing
Yes.
in Maisha Magic.
Yes.
And one of the ways of helping the couple is surrogacy. And I've been asking myself, suppose the surrogate mother bonds with the baby.
Okay.
The fact remains, the blood is for the surrogate, the uterus, the placenta, everything, and now the baby, the DNA is for somebody else. But this baby has fed me, and now I would like to have the baby. Whose baby is this?
The baby is not yours. This is your profession. It's like me, I'm a clinical officer. I'm there to treat patients.
Yours is to carry the baby.
I have no interest of anything outside my profession. So if that is a profession, you volunteer to be a surrogate mother. You sign a contract and you're paid. The moment you deliver the baby, your contract is done. You have your payment, you give me my baby.
I'm sure Pastor
so it's a profession.
is very, very irritable with the question. You can ask the question so that she can answer as you address the issue of terminating marriage because of infertility.
Oh, you want me to ask a question related to?
Yes, I saw you having one.
No, it is. It sounded very technical, very scientific, and I've just heard. I thought those were myths. I didn't know whether in reality it happens, and that's it's interesting. The only issue is when it comes to Christian faith, it's nowhere mentioned in the Bible. So now there I may not question much because okay, there are some things that are left to the individual person to make their decision. It's like what Paul says, if I find a brother who doesn't like eating meat and I eat meat, I won't be eating meat in his presence. But when I'm alone I'll eat meat. So there are some of challenges that people face that they may be forced to make their individual decision. And there we let them make their own decision because the shoe, the wearer of the shoe is the one who knows where it is pinching.
So
because this one we cannot call it immorality. You see, we are scared with immorality in the church. This it's not immorality. The man has not slept with another woman. You have said it's done outside. Then there it can be left to individual. The victims to decide. I can't preach that on the pulpit.
Okay, that is very good. And I am just thinking about how to address the issue of infertility when it comes to young couples. You know, there are what we call outliers of age. That is extremes of age. You are at the age of 20 to 27 to 30. You've not given birth, you've not conceived, you are at the extreme ages of the risk of age 37, and you cannot be able to conceive. All of them are facing the same problem. Riziki, how would you address this in terms of age?
Okay, both are desperate. They require desperate measures because this young couple has energy and the zeal to be a family. And these elderly people have not conceived yet. They have been there for many years and they are not able to conceive. So I would measure it equal, being young and being okay. Past 37 years, chances are lower because of maybe when you go older, we are approaching menopause. When you
Hormones
go
are
older, yes,
diminishing
hormone,
functions.
the ovaries are diminishing in number. They are produced not so healthy. You can't compare the two. So chances of a very successful modality of treatment to the young couples are high. I'm not saying 100%. It's high because you can receive at least even 3 times treatment without success. But for younger couples, the success might be higher. Older couples.
So the point is wait as long as all
Yes.
the things have been ruled out.
Yes,
so
just don't
told
get
us
treatment
there are medical
once.
treatment.
Yes.
You've told us there's surgery, if there is a mass in the uterus.
And the
so
surrogacy.
there is the surrogacy of
Yes.
which I cannot be able to talk about it because I've not seen the Kenyan law about it yet. I'm yet to look for it. So as we finish up with our show, I would like Pastor, you give us your parting shot in 1 minute, then we finish with Riziki.
Yeah, what I can say is something that Riziki said about the intimacy between the young couples when people come together. Let me just not say young because they become while at an advanced age. I've remembered in the Bible says that when a person marries should be given a 1-year leave. This was to allow the man and the wife to be together to be more intimate.
Wow.
That tells me that young couples or people young in the age of marriage, that's when they should be together in the first year a lot so that they may do a good job.
Thank you, Pastor, for that. Intimacy, very key point there. Riziki, your parting shot in 30 seconds.
Okay, infertility is not a disease. Infertility is not a death sentence. In Kenya, we have several options, several treatment modality. So I would encourage our viewers out there, our society and community, they stop stigmatization because it's not your fault. And there are several modalities that you can be able to carry a baby of your own genetics. And if not possible, there are several options for you to be able to have a baby.
Wow. Thank you so much, our guests. It was a pleasure having you in the show. Welcome again and again. This is GBS TV Africa. We are in Health Talk and we are bringing the matters as they are to you because they affect you, they affect the society, they affect our sisters and brothers. Just to finish up, I am saying that 1/3 of the population of people facing fertility, the challenges and the problems are with the man. 1/3 of them are with the woman, and 1/3, both of them may have equal chances of not having a child. So it is not about the man or the woman, it is about us, it is about the society. Kindly, if we are faced, let us seek medical attention, religious intervention, and more so psychotherapy through our psychologists. Bye. I was your host, Lucy Wanza Kariuki. Stay tuned for more shows. Bye bye.